Hello, viewers. You're welcome to our enlightenment program that seeks to enlighten you on issues that relate to your brain and spine health. My name is Dr Ubong Ekpene. I'm a consultant neurosurgeon with the University of Uyo Teaching Hospital, Uyo in Akwa Ibom State, Nigeria, and a lecturer with the University of Uyo. In our previous videos, we had looked at headache, and we said headache could be primary or secondary. We focused on the secondary causes of headache. We began by looking at brain tumor. We said there are over 120 brain tumors that have been described. And the aim of this video is not to teach us those brain tumors, but to use representative samples of those tumors to enlighten us on issues and symptoms to look out for that may suggest secondary causes of headache that may require us seeking help early. So we considered pituitary tumors and the functional and non-functional types, and we also considered meningiomas. And today we are going to look at the commonest type of brain tumor, and that is metastatic brain tumors. It is also called secondary brain tumors. It is called secondary brain tumors because it occurs firstly in other parts of the body, and it can arise from any part of the body. Cancer from any part of the body can then spread to the brain, either through bloodstream or through the lymphatics. And when they get lodged within the brain, they grow to various sizes, giving rise to these secondary brain tumors that we are talking about today, that give rise to various symptoms. So what are these cancers that can spread to the brain? The commonest of them is lung cancer, followed by breast cancer. It could also be caused by skin cancer, a particular type called melanoma. Kidney cancers that affect the kidney, cancers that affect the gastrointestinal tract, the stomach, small intestine, the large intestine, or other parts of the gastrointestinal tract. Any of these cancers can spread to the brain. Even prostate cancers in males. So name any cancer in the body and they can spread to the brain. It is stated that between 20 to 40% of cancers that occur primarily in other parts of the body can spread to the brain with time. So this is a very important tumor which we must know about. And so how do they present? Like other tumors that affect the brain, they can present with headache. Remember, we're discussing secondary or causes of secondary headache. So they can present with headache, which may not be different from other causes of headache, except that they become persistent and progressively worsen with time. Sometimes patients can have this headache worse at night and early hours of the morning, and can cause them to have a feeling of vomiting or actually vomiting. Sometimes it gives relief. It could also present as a stroke. Patient tells you that one side of his mouth is weak, is drooling saliva, one side of the mouth. And it can also present with weakness of the one side of the body, the legs, the hand on that side, weakened, making walking difficult. It could also present with changes in sensation on one side of the body. It could sometimes present with seizures, especially in adults who's having seizures for the first time. It's called convulsion. Either the person is jerking violently, the entire body begins to bite the tongue, begins to roll the eyes, clench the teeth, other manifestations. These may point to the fact that this patient may be having a brain tumor. It could also present with visual impairments. Not all visual problems is primarily from the eye. Sometimes it is as a result of a problem in the brain. It could also present with problems with memory. Patient has problem remembering things, may have changes in personality, behaving in abnormal ways that the patient is not typical of such a person, and there's sometimes a psychiatric manifestation, cause imbalance. Patient has difficulty walking well, and could also manifest in diverse ways. And it's very important that when we see these symptoms, that one should be able to seek help early. So how is diagnosis made? For diagnosis to be made, patient needs to see a doctor who, particularly the neurosurgeon who is trained to handle such cases, would see the patient, take a detailed history, examine you appropriately, looking out for suggestions or signs of tumors occurring in other parts of the body. And if there is a history that the patient has had any of these cancers, either the lung cancer, breast cancer, cancer of the skin, melanoma, cancer of the gastrointestinal tract, cancer of the ovary, the prostate, the testicles, name any cancer in the body, and that gives a strong suspicion that we probably may be dealing with metastatic brain tumors. And usually it's required that a scan of the brain is done and other tests to look for other primaries within the entire body. And if it is confirmed that this patient has a tumor in the brain, then the patient will require treatment. The treatment is usually surgery on the one hand, alongside other form of adjunct therapy that would assist in improving the condition of the patient as much as possible. And this could require radiotherapy, could require also chemotherapy, which is just use of drugs to try to contain the problem, the tumor, both the ones that is in other parts of the body, the primaries, and the ones that have extended to the brain. So how can this tumor be prevented? Prevention of secondary brain tumors begins with prevention of the primary tumors. And since we've said that lung cancer is the commonest cause worldwide of metastatic brain tumors, and we know that the single most important cause of lung cancer is cigarette smoking, whether passive or active, it means that in order for you to prevent yourself from developing metastatic brain tumors, you must prevent or stop smoking, or not start it at all. And if you have a predisposition in your family for breast cancer, then that itself also needs to be dealt with. So the key towards preventing metastatic brain tumor is to prevent the primary brain tumors. Sometimes you have no control about the primary tumors affecting other parts of the body, but whenever possible, it is best to prevent it, because eventually it can find its way to the brain and causes serious problems. Metastatic brain tumors are usually aggressive tumors that do not have good prognosis, and that is why prevention is key. So I want to encourage you, if you have this symptom, or you have somebody or know somebody who has such symptoms, it's good to present early, because early diagnosis and treatment can improve life expectancy as much as possible. So please share this video. You can also like the video. You can also click on the notification button, so that when we have other videos, you can also see them. Thank you.